Hello, welcome to the Gleam Show. My name is Fadzai and I am your host. I just want to say thank you so much for tuning into this show whereby we talk about topics that fall under finance, health, and family. Today we are talking about a topic that falls under health, and the topic is kidney failure, or some would call it renal failure. I have a special guest with me here today. Her name is Evelyn Rachel. She is a qualified registered nurse. She has worked in countries such as Zimbabwe, New Zealand, and Australia. She is also qualified in midwifery and in renal failure in kidneys. So, Evelyn, thank you so much for joining us today.
Thank you, Fadzai.
All right. So, to start off our episode today, what is kidney failure? There are some viewers who are watching us today, and some might not have heard about this or they don't know what it is. So, can you please just explain to the viewers today what is kidney failure?
Okay. Kidney failure, or we call it renal failure, it's a condition whereby the kidneys cease to function normal. That's what I can say in short. I don't want to go deeper in medical terms but I think this one viewers can understand that it's when the kidneys fail to function normally.
Okay. So I think you mentioned before when we're just having a discussion that there are different types of kidney failures. So what are the different types of kidney failures?
Kidney failures or renal failure, it's got two types. There is what we call acute kidney injury or acute renal failure. And then we've got chronic renal failure or chronic kidney disease. So I will take you one by one just to explain what we mean by acute kidney injury or chronic kidney failure or disease. In acute kidney injury, that's when the kidneys are damaged just suddenly. This is just something that is happening suddenly. There's no warning, and mostly this happens, like, take for example somebody who has been involved in a road traffic accident and then get injury of the kidneys. That's an acute setup. And then also acute kidney injury, like when it happens somebody who is pregnant, and this can happen to somebody who has been well, but because of the pregnancy then start to have some issues, and then kidneys are damaged. These are some of the examples that happen. And sometimes it could be infection that is causing one to have acute kidney injury. So what we are saying is these conditions, they can be reversed. One can get back to normal. The kidneys can start to function again.
Oh, wow.
So the most important thing is the timing, to say if one is in an accident, involved in an accident, the length of time that is taken for one to get medical help, that matters. If it's infection also, the time when this patient start to have medications to treat that infection, that is very important. So in pregnancy also the same thing. This pregnant woman who has developed acute kidney injury, she needs to be treated. What is it that has happened to this lady? So treatment should be started as soon as possible so that the individual will not lose the kidney permanently. I think I've explained
The acute one.
yes, the acute kidney injury.
Yes.
There are many things to talk about. Otherwise, we can spend the whole day talking about this acute kidney injury. And then
You mentioned
something,
chronic.
yeah, something also blood loss on that acute kidney injury. Something that I not talked about. Blood loss, bleeding, yeah, can lead severe bleeding. Can lead somebody to have acute kidney injury. So let me move on now to chronic kidney disease or chronic renal failure. And in this one, we are talking about the kidneys that are damaged completely. There are many things that can lead, or many causes that can lead somebody to have chronic kidney failure. We cannot forget also that acute kidney injury, if no help or medical treatment is not done quickly, then I said one can go to chronic kidney failure. That acute, the patient will not recover because help was not rendered quickly, and then there's no reversal, and then when one ends with chronic kidney disease. But other things that can lead one to have chronic kidney disease are like conditions like diabetes mellitus, which in normal terms like sugar disease, okay? Diabetes mellitus is sugar disease. One might be born with diabetes mellitus, and we call that type 1 when it's like hereditary. One has been born with it. As a young baby or child, they'll start to have this diabetes mellitus, and they are managed by putting on treatment. Or maybe it could be type 2 diabetes mellitus. This is one that is acquired when one is like in maybe mature in adulthood, and they start to have diabetes mellitus due to many causes. I will not go to the causes of diabetes, otherwise it's like changing the topic. So I just mentioned partially to say, okay, this could be diabetes mellitus type 1 or type 2. And maybe somebody who has got this diabetes mellitus, they are not being managed well, or they are not taking their medication well. And then, or maybe it could be due to some medications that are also used to treat that diabetes mellitus that can lead somebody to have renal failure, chronic renal failure. Then another condition that can lead one to chronic renal failure is hypertension, which is high blood pressure. So high blood pressure, if it's not maintained well as well, then it might lead one to kidney failure. It just depends what is happening. Then it could be due to hereditary, some conditions like polycystic, we call it polycystic kidney disease, which are hereditary, running in the family. So which means that as human beings, as we grow up, we need to be checked to be ruled out of these conditions, because somebody might be having it, but you are not knowing that you have got it. The hereditary conditions. So they play a part as well as leading. One might be born with one kidney, and that kidney might not be functioning well. And one might have, it could be due to cancer, it could be due to myeloma, it could be due to leukemia, or these neoplasms. They can lead one to have kidney failure. Then another thing also, blood loss, as you have seen in acute kidney injury. Blood loss, severe blood loss can lead one to also chronic renal failure. And others, there are many conditions, conditions of the kidney itself. We have got conditions we call glomerulonephritis. And also, yes, glomerulonephritis or nephritis, also pyelonephritis. These are conditions in the kidney. So I talked first of the condition outside the kidneys, and then the condition in the kidneys that can lead one to have chronic renal failure. And then we have conditions outside the kidney, like in the bladder, conditions of the bladder, where there is bladder. I think most of you know what what a bladder is. Yeah, you know what a bladder is, which is a reservoir of your urine. So if there are any problems in that bladder, like obstruction, something that is obstructing the urine to pass through out, this can lead to chronic renal failure. Strictures, this can also cause chronic renal failure, and anything also to do with the ureters. Yeah, somebody can have post surgery when one has had the surgery of anything to do with bladder or ureters, and then something happened and the ureters are damaged. This can also cause somebody to have chronic renal failure. And then we have conditions like infection also, severe infection, which other than trying to use antibiotics on the individual, there is no change, and then the kidneys are damaged permanently. It could be due to some toxic substances that one has been taking.
Oh, wow.
Yes, we have got these drugs, we have got some medication also can lead one to have chronic kidney failure. Some medications, maybe someone has taken overdose of the medication, and this can lead to chronic kidney failure. And also alcohol intoxication, it can lead to kidney failure, chronic permanent damage. So there are a lot of things that can lead also to chronic kidney disease that we can spend more time talking about. But what I just want to say is, most people out there, they don't know what the kidneys do. They don't know that this kidney failure is affecting many people. It doesn't matter what type of, which country you come from, whether race or whatever, it affects all people.
Even the age.
Anytime, even age, even sex. So it's a disease that is silent, but we have got so many people being affected around the world. But people, they lack knowledge about this kidney failure. They lack knowledge. It's when one is sick, that's when they start to know what has happened.
Okay.
Of which knowledge I think people need to be equipped out there to know that as you take care of other organs of your body, the kidney, which is regarded like a small organ, but it's doing a lot of things. We are going to talk about the specific functions of the kidney so that you understand when they go wrong. When you talk about the symptoms, then you know that, oh, okay, we're supposed to do this. So I will quickly, because I know there's a lot of things to discuss about, but I will quickly, I know we are supposed to talk about signs and symptoms, but before we move on to the signs and symptoms, I just want to talk about the what does it do, the functions of the kidney itself.
Okay.
The kidneys, they are supposed to be maintaining fluid balance in one's body. What am I talking about? When you drink water, when everything is okay, when you drink water and then the kidneys, they form the urine and then it comes out of the body, it balances. But when there's a problem, you will find out when you are talking about the symptoms that there is no balance of the fluid. So we are saying the kidneys, when everything is working well, they are supposed to balance the fluid. When you drink, then when they form urine and then it comes out, the body takes what it needs, that water, the percentage of water it needs, and then the rest is formed into urine and comes out. So it's responsible for formation of urine, or also for balance of the fluid in your body. The kidneys also are supposed to regulate one's blood pressure, maintaining one's blood pressure so that it's not very high, it's not very low. Because there is a hormone, when you talk about hormones, some might not understand, but there's a hormone in the kidney that is responsible to make sure it maintains the blood pressure. The other thing that the kidneys do, they are supposed to store the iron. I think some of you have heard, I'm not talking about the iron, the mineral, I'm talking about the blood iron, okay? So it's the kidneys that stores, it's like a warehouse storing this iron. Then the kidneys also, they've got a hormone which is supposed to secrete or making sure that you've got red blood cells. So it's like manufacturing red blood cells. Do you know about red blood cells? Yeah. It's needed for your hemoglobin level. You've heard of HB. The hemoglobin level is low. The hemoglobin level is low. Yeah, it comes from the red blood cells. These are manufactured in the kidneys. So you see the importance of the kidney. And then the other thing is it strengthens your bones and joints. How? How does it do that? It activates the calcium that you eat from. You eat calcium, you get calcium from the dairy foods that you are eating, and you get what is called phosphate from the foods that you are eating. So kidneys works on the calcium and phosphate. Calcium and phosphate are like friends. Yeah? We get it from the food that we eat. But the kidneys are the ones that will action on the calcium and phosphate. And then to make sure your bones and joints are strong. Oh, wow. Then the other thing, it maintains the body temperature. Yeah, it's funny, is it? It maintains your blood pressure. I mean, it maintains your temperature. You see, I'm feeling cold. The kidneys, they maintains the temperature of the body. And also it's responsible for the acidic and alkaline base balance. I'm like going deeper. I won't say more about that. And then it's also responsible for excreting or removal of toxins from your body. Yeah, after you eat your meal, and then the body takes the nutritious food and use it on the parts of the body, but the rest is to come out. Yes, is to come out is because these are toxins. If they remain in your body, they'll become toxic in your body, and you end up sick. So it's filtering the toxins, filters any extra water in your body. That's the job of the kidneys. There are many things I think I've talked about these kidneys function. I mean, the kidneys job. What are the kidneys doing in your body? I've talked of many things, but yes, most of you, I think you knew only one or two. You knew only about removal of toxins. Yes, mainly filtering the blood. Yes, filtering the blood, removing of toxins, removing maybe of extra water. That's all. But all this I've talked about: hemoglobin level, isols, maintaining blood pressure, maintaining body temperature, also strengthening the bones and joints. Some of you were not aware. Yeah, we've learned something. So this is a very important organ that people are not talking about. So let's move on to signs and symptoms. Right. So since I talked about the function, so you must be knowing some of the symptoms that one might present. Okay, let's look at somebody having toxins in their body. The toxins that are not being removed because the kidneys are not functioning well. So what happens when the toxins remain in the body? in the bloodstream. One start to be sick. You start to have nausea and vomiting, loss of appetite. You can't eat. Loss of taste. Some might complain of the metallic taste in their mouth. And if you come closer to somebody who is so sick with kidney failure, then you smell the urea. And also, even if they brush their teeth, they will be smelling. That smell will be coming strong from their mouth. And the other thing that can happen when the hemoglobin level is low, because I told you the kidneys, they are responsible for manufacturing red blood cells, which is needed for good hemoglobin level. So because the kidneys are not functioning well, mostly you find the patient is anemic. They've got low hemoglobin level. And the only way to manage that low hemoglobin level is to give the patients, it's either the patient is put on injectables, what we call ESAs, to boost the hemoglobin level. We put the doctors put the patient on erythropoietin injections or Mycera injections. There are many types that can be used to boost the hemoglobin level. So the patient will be given that injection. Later on, we'll talk about that when we are covering dialysis during another day, another session. So also, I said the other thing that might happen with kidney failure is low iron stores level, because it's supposed to store iron, but it's not function. Then when one is tested, blood test is done, then you find that the iron is so low. So the doctors will start the patient on iron infusion. This can be arranged through if the patient is in hospital, the first dose is given in hospital. If the patient has to have maintenance dose, then it can have through the GP if the patient is discharged, or through hemodialysis when patient is having dialysis. And then I talked about bones being affected because of the calcium and phosphates. What is happening here when one has got kidney failure might have high phosphate, low calcium. There is no longer a balance between the two, because when the kidneys are normal and working well, there is a balance of calcium and phosphate, and the kidneys is able to work on these two minerals to make sure your bones and joints are strengthened. But because now the kidneys have failed, there's going to be imbalance. You eat the food that you normally eat, but now it takes what it needs, the body, but what's supposed to come out, those toxins, the high phosphate, which is supposed to come out, the other level, is not coming out. It remains in the blood circulation. So that will be toxic now to you and to the patient, and then the patient will be sick. What happens with high phosphate? High phosphate, one will be having symptoms like itchiness, itchy, they will be scratching all over. Some they will need these scratching sticks, which are made necessary for one to be able to scratch over their body. And the treatment of that is this patient has to reduce their intake of phosphate, and also they might be put on the medications, what we call phosphate binders. And besides itchy skin, one might have bloodshot eyes. You see red eyes. You might think maybe he had a fight or she had a fight with somebody. No, it could be that high phosphate. Oh. If it's not allergy, if it's not an allergy, it could be high phosphate.
Oh wow, you've talked about a lot of
yes.
signs
and then this other one that can happen is the fluid overload. Remember I said one of the functions of the kidneys is to balance the fluid when the kidneys are functioning. But in kidney failure, there's no balance of fluid. So if you are just going to drink like anyhow, what you used to drink before, you will end up being loaded in the system, right? You end up with fluid all over. And then that fluid now, we start to see it in your legs, in your feet. They are swollen. You are carrying a lot of extra fluid in your body. The body is not, the kidneys are not able to remove the extra water as it's supposed to do. So it remains in the body, and we see it. The swelling could be in the feet, the legs. It could be also some people on their hands. It could be on the face, puffy eyelids. It could also happen in the waistline. Some people carry fluid in their waists. So all this now, this fluid, if it doesn't come out, that extra now, if nothing's done, then it end up into the lungs, which is a severe state. It is a severe condition. When it gets into the lungs, you know what are lungs for? What do they do, the lungs? So now what will happen is the patient will complain of difficulty in breathing or shortness of breath. They are like panting, gasping for air because the water is now in their lungs. So something has to be done to get rid of that water. It's either one is put on medication, furosemide, which release that water, and also one put on dialysis, and also one can be put on strict fluid intake. So we have to tell the patient now to say, no, instead of just drinking anyhow, we need strict measure, like maybe 750 mils a day of liquids. That is your tea, that is your water, anything liquid. It's in that 750 for 24 hours, 750 only. So you see how it can be so hard for one who is sick, but for you to be better, that's the only way you can do. You have to follow the orders, restrict your fluid intake. You are now balancing for your body because the kidneys can't do it. So all these are the symptoms, and some can have disturbed sleep. They can't sleep well. What we call they can't sleep well because of the condition they are having. So we encourage one to sleep in the afternoon, can take a nap since you can't sleep well at night, and one can have what we call restless legs. These are legs that will be just kicking of the leg without you aware. It's just kicks. I was going to demonstrate here, but you won't see it anyway. So that one can lead to someone not be able also to sleep well. And if you are sleeping with your partner or your wife, your husband is kicking, it's not going to be fair. So some they end up looking for another bedroom. You need to use the spare room, running away from this partner who's kicking. So the doctors will put the patient on medication to make sure that this stops. So there's a lot of things that when the kidneys are damaged, you end up with so many things affected and so many signs and symptoms.
Oh wow, it is really a lot. So when you were mentioning the signs and symptoms, and when people get all this kidney dialysis and everything, but before they reach that stage, what sort of medical investigations are done to see if someone has kidney failure?
Okay, so mostly where the patient is being managed, mostly you'll be having a GP or general practitioner who is managing you, is it?
Your doctor.
Yes.
Mm-hmm.
So they do these blood tests. So the blood tests are many. We are doing, they do blood tests like urea and electrolytes, to check creatinine, to check the potassium, to check the phosphate, to check also hemoglobin level, if it's low, to do the iron studies, to check the level of the iron, also to check the calcium levels, to check glucose level, if somebody is diabetic or not diabetic, just to see where the level is. Also to do what we call parathyroid hormone test, all those tests that are done to rule out, to make sure what is going on, so that the doctors will be able to manage you. So the GP who has been managing you for so many years, if you've got a GP, is the one who will pick that, I think this blood test, I need to refer the patient to a renal specialist, what we call nephrologist. So the GPs, they should not waste the time with the patients. If they see there's a problem, they should refer the patient to the renal doctors, to the renal specialist, nephrologist. Timing is good to send the patient, not wasting time managing what they are not supposed to manage. So when the patient is referred to the nephrologist or renal specialist, they will do also this test. They will run this test, yeah, to make sure that they pick the problem as well and manage it. So like I've said before, if it's hemoglobin level, they start the patient on injections to boost the hemoglobin level, or call the patient to hospital for iron infusion and all that I've talked about already. And for the phosphate, one gets phosphate binders. And also, I will talk about diet at the end, but let me talk about these which are done first. Yes. So besides blood tests, they can have X-ray done. They can have also what we call biopsy, MRI of the kidneys, biopsy of the kidney to see what percentage of damage, what percentage is still okay. This will help the doctors to see if they need to send also the patient for admission in hospital, depending on the condition, to say, you need to be admitted in hospital. You go to the emergency rooms so that you'll be admitted, and we are going to do the rest of these investigations whilst in the hospital. It depends on the condition of the patient. But if the patient is still okay, the nephrologist will have so many times that you'll be reviewing the patient. Like you might be reviewing the patient once every 3 months. Some can get reviewed for many years. They've got kidney failure, but it's not to the point of them being started on dialysis. So it depends on the timing from GP to the nephrologist. You might spend, we have seen patients who have been being managed for 15 years. They were told already that your kidney function is declining, but at the moment you are still okay. You do this 1, 2, 3. So they will continue being monitored by the nephrologist. You'll continue to do blood tests every time they go for review. So it could be monitoring every 3 months, for those years. So some say 15, some 10 years, some 5. But you see also people who just been seen like 1 month and they are started on dialysis because it was never discovered during all these past years. It just happened suddenly. So good timing, you can see it plays an important role for one to be managed, because one can stay for many years without being started dialysis, being managed on medications, being managed on fluids. You'll be told what to drink, or maybe they are put on this furosemide, which furosemide is the medication that will release that water. It will get rid of the water, extra water from the body as well. So this patient during that period is being told what to do so that they don't go into this permanent damage of the kidneys. And the other thing, besides medications, besides being blood tested done, the other thing is, if you are a smoker, smoking contributes to kidney failure. Okay, so I know it could be a gray area, but this is the truth. Smoking can also be a problem. So the person who is smoking will be told to stop smoking. Okay, stop. I know it won't happen just instantly, but gradually you have to stop smoking. Otherwise, this will contribute. Okay, it's risky when you've got kidney failure and you still smoke. Then the other thing is those who drink alcohol. It's not good to continue drinking alcohol when you've got kidney failure. So the patient is being told to stop drinking alcohol. Really, in some cases, might be allowed just a small glass of alcohol, but it's rarely in rare circumstances. Then the other thing besides all this one, you have to make sure your diet. Some are referred to dietitians during the period before starting dialysis, so that the dietitians, they have specialized in meals, in food, and they can also inform the patient, because malnutrition is risky to somebody with kidney failure. So you need to eat well, but you need to eat right foods. I'm not talking about quantity, because about quantity, it's like specific when somebody has got diabetes. When you've got diabetes now, then you need a renal dietitian to tell you about the quantity of the food that you need to eat. But I'm just covering as a whole, whether one has got hypertension or what, but we are talking about kidney failure, that you have to eat food which is low in phosphate. You might be waiting now for going for dialysis, or maybe you are having dialysis. You need to eat food low in phosphate, and you'll be given a diet sheet with the listed foods for you to know which one. But from my experience, almost all the foods we eat, they've got phosphate in them. Oh. So you need to check those foods with low phosphate, and then you eat those ones. Because remember, the phosphate will be high most of the time, because the kidneys cannot remove those toxins extra from your body. So you need to help your kidneys now, so that you don't have this condition of scratching, you're feeling itchy and all of that. And this too much phosphate also in your body can lead you to bone disease. It will affect your bones and joints. Remember I said, phosphate, when your kidneys are working well, phosphate and calcium are used to strengthen your bones. But if you've got kidney failure, now the opposite. Your bones and joints will be affected by too much phosphate and calcium. So you need to reduce that. You need to reduce phosphate foods and pick that. And the other foods that you need to be careful of when you've got kidney damage, or we are in that period now when you've been told that part of your kidneys have been damaged, you need to reduce the potassium foods. Potassium you find in many foods, like just for phosphate. You find in vegetables, you find it in cereals, in meats, in fish, but you choose the foods with less potassium. So again, you get a diet menu or list with these foods listed, so that you'll be able to choose to say, oh, when I'm going for shopping, I need to pick this and avoid this. Let me just say, like, when you talk of fish, you're allowed to eat the fish, but you find the snapper has got too much potassium and phosphate in it. The snapper, it's a good fish, tastes nice, but it's got too much potassium, too much phosphate on it. And also bananas. I'm just picking just a little bit of food so that you have an idea. Bananas, they've got too much potassium in them. So when one is diagnosed with kidney failure or waiting for dialysis, or they are on dialysis already, we say cut out bananas. They've got high phosphate in them. So this is something that will help the patients with kidney failure waiting for dialysis or dialysis to move on with life. To make sure you stick to what you have been told about the diet, the right foods to eat and the ones to avoid. That will help you. And also, if you are put on fluid restriction, make sure you measure it. Don't play around with that, because it will help you so that you don't get the swelling, and also you don't get the water into your lungs. And then once you've got water in your lungs, you get admitted in hospital. So we need to be listening to what the doctors are saying. So this is all I can share on the management, what one has to do, about the medication, about the nutrition, all that. But the main thing, the main management now of dialysis, this I'll leave it to another session, because there's a lot to talk about dialysis. And when, because suppose this patient or person has been managed for 10-15 years, what time do one start dialysis? We'll talk about it in our next session, and then we talk about the types of dialysis and all that.
Oh wow.
Yes.
Awesome. I would like to thank Severine Rachel, who has taken her time today to talk to us about kidney failure. I don't know about you, but I have learned a lot regarding different types of kidney failures, acute, chronic. I have learned about the tests. I've learned about, the diet itself. So as you have been watching, one of the things that I have actually got to know through this episode as well is the timing is very important when one is diagnosed with kidney failure, getting the right amount of treatment, because Severine Rachel here mentioned that some kidney failures can be managed. You won't be put on dialysis straight away, but they can manage it through various ways, watching your diet, medications, and all the stuff. So I just want to say thank you so much for tuning into today's episode. Share with your family and friends, subscribe, and on our next episode, as Severine Rachel mentioned, she will get into deeper regarding the dialysis to do with kidneys. So until next time, I want to say thank you, and it is bye for now.
Bye, viewers.